So good evening, everybody, and a really warm welcome to this evening's event, which is part of a linked series from the RCN relating to the history of children's nursing, which is an exhibition that's currently on there. So if you're in London, and I see a few of you are, it's really worth visiting before it moves on a little tour up to Scotland. But you can also see online from our colleagues who are joining us from North Lincoln, Stockton on Tees and Nottingham. So welcome. We have a really exciting programme this evening. So I do hope you're comfortable, you have something with you to drink, and just a little warning that we are going to be dealing with some sensitive issues tonight. So if anyone feels particularly triggered by anything we discuss, I would direct you to the RCN website where there is help and support available. And we also have the privilege of having two young people this evening, who you will meet a little bit later on, but extra warm welcome to them. And please use your chat function for any questions you might have. We'll be taking them at the end in the panel. So without further ado, I'm really excited to introduce a colleague who lots of us know very well from the Children's Network, but also from nursing. And that's Dorcas, who's going to tell us all about the street clinic and working with young people exposed to violence. You okay, Dorcas?
Yes, I'm so sorry. I was fussing with many things. Thank you. Just wanted to make sure I'm at the beginning. Thank you very much, Lynn, for the warm introduction. Thank you so much, Sarah, for organizing, and your team for organizing this event. I'm deeply grateful. It means so much to me as a nurse, but it also means so much to the innovation that we nurses bring into the NHS. I'm deeply indebted to the young people I work with, I continue to work with in many different capacities. They shared their deepest vulnerabilities, and as a nurse, I'm bound by their compassion and care, but also I'm protecting their lives. So please bear with me if I make a lot of noise about the need to protect them in every way. I'm incredibly indebted to my supervisor, Dr. Tammy Kramer, a supervisor and a friend in many ways who supported me in doing my work as a nurse in Westminster and continues to support me in every way. My background speaks to the work and how we arrived there. I came to the UK as a 20-year-old looking for work, really, in the wake of the HIV crisis in Zimbabwe. I'd lose 3 brothers to HIV. I worked as a hospital cleaner in Edinburgh. I really wasn't looking to be a nurse, and I was admiring these nurses working in the hospital, and later becoming a healthcare assistant, moving to London. Background in public health, and a call that came at some point whilst working for a safeguarding charity, saying, could we do a piece of work together looking at mental health needs for young people involved in gangs. Everything else I'm doing now has a lot of meaning, but for some reason, those early years of my career, I have such solid foundation. The world feels very troubled. Sometimes London feels very troubled as well, but I always start here with a poem by Wassan Shere, British Somali, who says, and I quote, later that night, I held an atlas in my lap, ran my fingers across the whole world and whispered, where does it hurt? And I answered, everywhere, 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 unquote, Wassan Shere. And I know that we're hurting today in many different capacities, but if from that place of vulnerability, I hope too that we can find some solutions. My clinical story begins here. One night I'm working in A&E's St. Mary's Hospital in Paddington, 2 o'clock. I'm holding a bleep as a junior nurse, and a young man has come into hospital. He'd been stabbed. This is way back before police and A&E departments understood youth violence in London. And no sooner had he come in with his friends, sooner or later, another group of people came in. They wanted to stab him again. A big fight broke off in our A&E department, which resembled the front line of any war that we'll see today. Baffled, the kids were separated eventually. The face of Britain to me looking unlikely that this could happen here. Later that night, the young lad doesn't make it, and he went later when his mum is told that her son has passed away. She's from a BAME background, and she lets out the scream that is really, really familiar with me. She cried and expressed her grief in the way that I know people express their grief. I'd heard it before from the HIV field. Back in our years, the generation who died, many died in HIV crisis without access to treatment. And I began to ask myself as a nurse, what would I have said? What could I have done? What would I have said if I'd had a chance to speak to this young person? And so when the opportunity came to work with this group of young people, I wanted to do so much more. This is a space this is London, my dear city. I love it. But this also gives space to some of the vulnerabilities, environmental vulnerabilities that we have. We have gangs in our city, and they're spread out. Gangs are a function of violence. They're by identity. They're about money. They're about territory. They're about girls. They're identified in many different ways. We were commissioned to work in Westminster, but we through intelligence, developed a lot of knowledge about how young people were being vulnerable to gangs. With drug dealers need a lot of people to run their drugs. And who better else to recruit than your very vulnerable, low-hanging fruit, who are invariably people with conduct disorder, learning difficulties, ADHD, excluded from school. So these were the groups that we were working with, the most vulnerable, who may have had a pre-existing diagnosis, but some didn't. And we functioning diagnosis were very much a conduct disorder. It's a very public picture many of you will be familiar with. But I give the context here of 20% of girls' involvement in gangs, the periphery of gangs, not themselves forming gangs as an American context, but they're certainly involved one or the other. I was really interested in the outcomes of minority kids from this background, because I'd also won a grant from the Mary Seacole Trust to look at outcomes for healthcare for young people from minority backgrounds. So when we're given this, and this is the key of this, when we're given this piece of work, we really needed to come up with engagement tactics. Our clinical tactics, our clinical structures, which are 9 to 5, write a letter, come and see me on the 23rd of January or 23rd of July, weren't going to make. And we designed our interventions around their lifestyles. These kids don't get up until 2 o'clock in the morning. They maybe hang out in McDonald's, in KFC, in parks, wherever they are. I was that nurse who accessed them where they are. Prisons, wherever they might be. We took a really, really big interest in parental mental health. And if we dig deeper, if you look behind that, a lot of comorbidities within parental mental health, but also physical health. And so we stretched our interventions. And I could spend a lot of time talking to those. But what does it mean from a mental health perspective? A lot of what we came through, and these are a very brief picture of what our mental health outcomes were. And I want to highlight just 2 things here. Sleep disorders were really associated with anxiety and depression, but also just trauma. Substance misuse, a lot of cannabis, but never smoking their heroin or crack or class A. That's business. You don't sell, you don't smoke your business. So a lot of substance misuse around cannabis. Suicide was rare, really rare, remains rare. But when it comes through, it's very aggressive and it's very violent, sometimes associated with drug deaths. So some testimonies here. I'm the first one in school in it. There's no food. And it's really speaking to the poverty that we have in our communities. When the gun was pointed to my face, I saw my life flash away. Forgive me for a spelling mistake. I'm banging 5 girls at the same time. Okay, 16 years old, he's probably not slept with anybody, but he's trying to make out what that masculinity means. But also, we don't work with some of that language and some of that behavior. You and I can imagine where it takes us. And I'm the first in 3 generations to get a job. On 1 generation, white British young lady, we look after her. And you arrest our children, you chase them, and who protects them? A real protest from families. We're hearing this from communities. And you can't be gay and be in a gang. It doesn't happen. I hear this all the time. And I say to my kids, guys, if you're gay and you're living on an estate, you really need to hide your sexuality. You might just want to join a gang. And I love the last one. I'll always be at home for you. And with that, we maximize our interventions. These are a few more testimonies, and I'll let you read them before I move on very quickly in special time. And I love the last one. If I'd stayed home in Sierra Leone, my son will still be alive, even with Ebola. And that speaks so much about risk and environment. So when we were given this piece of work, and I'll run this through very quickly, there's no way that we could have just used bread and butter nursing interventions. And I took a lot of lessons from the most unlikeliest places in the world. When I won the Florence Nightingale Foundation Trust, I went back to Zimbabwe, took some lessons from the HIV experience there. Again, similarities in this context. And when I'm not in the NHS running around with the bleep, this is where I love to be, in Zimbabwe, in a psychiatric unit, learning lessons. I urge everyone to look into Friendship Bench Project, an excellent project that uses community healthcare workers. In the absence of nurses, psychiatrists, and psychologists in that community, they're using grandmothers to scale up some interventions in mental health. I've got I'm going to play literally a minute of this because I'm conscious of time, but I want to give context as to where we took those lessons from in the environment, which I think to me matters, and the use of young people. Thank you very much for engaging with that. Just move that. So what did we take from Zimbabwe? What did I personally take from Zimbabwe in enhancing my own nursing interventions and expanding my innovative thinking? The whole idea that we can demystify mental health. Well, look, it's for common mental health disorders. We can, at least for common mental health disorders, we maybe don't need to call it depression, anxiety. That's a very Western model. We could just call them problems, because everybody has problems. And this was very much the evidence based from the Friendship Bench Project. Everyone has problems, not problems with money, problems with mother-in-law, problems with our son who's smoking drugs. With problems and coining problems, we get better engagement. But also the use of young people in interventions. Again, that's an intervention, and the whole idea of using communities, young people came from that space. And that trauma is a collective rather than individual experience. The whole idea, and it's coming again from the HIV experience, that if we are open ourselves to the idea of that we are all traumatized, one way or the other through knife crime or violence, what does that mean from an Ubuntu point? An African concept of Ubuntu is the whole idea that we as a collective need healing rather than individuals. And that has actually a better effect. And some cultural considerations to engagement. It does matter. Greetings do matter. What I wear when I walk through those doors does matter. How I speak matters. How I engage matters. Whether we say, good morning, Makadini, Salam alaikum, Salam alaikum. jumbo, whatever that greeting is, and tapping into those communities with intention really, really matters. But the role of matriarchy and those social groups, highlight here the importance of recognizing the role of young girls in those communities. Often they are highly exceeding in academia. Well, sometimes their brothers on the streets, and using some of that social capital and cultural capital in communities. Here we are in Global Health, the Friendship Bench project being launched in London with its use, a simple step, cost-effective method to reach communities. So with that, thinking through some of those interventions, we created a space. This is the Global Health Cafe, formed with Ade Adeyemi, one of my colleagues in Global Health. We were talking to a lot of young people, particularly in the academic space, and a lot of them would often keep quiet in the audience. And at the end of that talk, they would rush to the end, and they have thousands of questions. We began to ask ourselves, why are people not speaking up? A lot of those were girls from minority backgrounds. And we formed the space that they own, they run, and they determine, with focus on inequalities in Africa as a base for learning. So what is Street Clinic about? This is a book that would be of interest to anybody who is coming from a mental health nurse, who's working with young people with highly exposed to gangs. Being very sensitive to their lives and their experiences, and unpacking mental health and trauma in young people, and something that we're not open to. The data on this, even from a qualitative point of view, a storytelling point of view, is still very poor. Understanding comorbidities and poverty and how that is playing out in our communities, but it's also about the intersectionality of issues such as human trafficking, exploitation, and gender, how that is planning out in our cities. It is also about good outcomes. Not all is bad. Girls do really well, and they get out really quickly with support. Boys too. Some tips here as I round off my talk about how we engage with these young people. It isn't about your professorship and your PhD isn't actually going to matter. It's whether you care or not, and whether people can trust you or not. And that's really important. Please don't ask them who stabbed you. We don't go down the line of naming names. We lose trust. And you may well hear, and you may well look after a parent who said, I've been depressed since my son was stabbed 2 years ago. That has repercussions on the mental health. Teachable moments, if you have 5 minutes with them, please use them, please educate them, please learn from them, and please give them space to talk. Risk assess, as services do. Our services are not designed for this group, but if you risk assess, please do something in the end, at least refer someone else. As we talk about this then, when I, as an RCM member, I'll put this and I say, this is how we decolonize global health in the end. We really are sure about how the West and the global health, the global North, the knowledge and the funding is skewed to the global North. This is how we do that innovation in terms of bringing back some of those knowledge experiences. But it's also about opening up ourselves in that learning space to take lessons from the unlikely spaces. It's also about thinking through art, the role of art. I became young again when working with these young people. But what I will say on the slide is that this isn't about, but these are young people highly exposed to HIV. Some of them may well be HIV positive. Certainly their parents are. I can talk to them all day about HIV. They know that. They can teach me a lot about HIV. I ask my kids in London, are you protecting yourself? Are you using any protection? I'm worried about HIV. And my kids in London will say to me, Miss, what is HIV? That's deeply worrying. And so I leave the discussion here with one of my favorite writers ever, who burns for inequalities and social injustice, Arundhati Roy, who says, and I quote, if we're ever to lose the ability to be emotional, if I was ever to lose the ability to be angry, to be outraged, we'd be robots, and I refuse that, unquote. Thank you for having me. Thank you.
Dorcas, thank you so much for an amazing presentation. I'm sure everybody was listening as intently as I was. And what comes across so much is your warmth and compassion for young people. And you've taken us globally and locally. And I think everyone can take a message for their own practice from what you've told us today. So perhaps we can do that, everybody. If you'd like to put that in the chat, one thing you're going to do after hearing Dorcas speak today. I've got a very clear message from one of my young people who said they'll decide within 10 seconds of meeting somebody whether they're going to talk to them or not. So think about what is it you can do differently that will enable that engagement. So thank you, Dorcas, and you will be able to post questions to Dorcas when we have our panel coming up quite soon. And I'd like to introduce our next speaker, Nusheen, who's also a nurse and has a huge interest in children and young people's mental health, but specifically related to an area of research she's going to talk about now and introduce us to a video, a trailer. And our young people are going to also be here to talk to us at the end of that. So without further ado, Nusheen, would you like to talk us through the trailer and a little bit about the film?
Yeah. Hi, everyone. I'm Nusheen. Thank you, Lynn, for that lovely introduction. I am a nurse, as mentioned by Lynn. A little bit of background from me. I've worked within the mental health field with young people for on and off about 22 years. For the last 12 years, I've been working as a nurse. I've worked within adult services, but predominantly my experience sits within children and adolescents crisis teams. So at the time of being introduced to the film project, I was working as an advanced nurse practitioner in a West London A&E department. And in preparation for this talk today, I've sort of gone through or re-traumatized by the whole process of what it was like to be a nurse during the pandemic and how quickly we had to react and adjust the services to make sure that it was still accessible to our young people. I specifically recall conversations amongst the nursing team at the time was, when are we going to see the surge of young people coming through? We expected to see a massive increase in the number of referrals that we saw, specifically crisis presentations. But interestingly, for about the first year, post-lockdown, the number of referrals to crisis teams plummeted. We were all left quite scared, quite worried. A lot of the conversations with our team was, where are these young people? What is happening to them? How are they coping? Because the pandemic brought with it a number of stresses, not only for the young person, but also for the environment in which they lived in. Socially, their social connections were all of a sudden taken away. And also the amount of stress that the parents were under, which was obviously going to have an impact on the young people. So during that time, I suppose I managed to get in touch with one of my passions, which is how can we use creativity and art, like Dorcas mentioned, to help not only educate our nurses, but also educate our young people and step away from the traditional sort of psychoeducational model of speaking at them, but rather how do we connect to them on their own level? How do we connect to emotions? How do we normalize some of the topics that are still quite taboo in our culture? So that's when I was introduced to Chris, who hopefully you'll meet in a minute. He's a brilliant director. He's made quite a few films trying to encapsulate some of the mental health difficulties within our population. And my role started off as being more of a consultancy role. So we managed to have a look at the research that was conducted by Dr. Lindsay Dewar from Imperial College, who actually specifically looked at the impact of the pandemic on children's mental health. And my role was to try and echo some of the experiences that we were seeing in clinical practice and trying to brainstorm around what the key storylines were going to be. What did we want to capture? What message did we want to put out there? So through the discussions that we had and the statistics that I had access to in terms of what we were seeing on the ground, this was statistics that wasn't published yet. We actually realized that approximately a year into the pandemic, there was a massive increase in the number of referrals to the eating disorder service. Something close to, I think, 70% increase in the number of referrals to their service. But what wasn't captured in this data was what we started to see in A&E. And that was a lot of young people who presented with comorbid mental health difficulties and disordered eating, which often doesn't get as much recognition. So we'd agreed that that was going to be what we were going to run with. And then the wider storyline was, how can we represent a lot of those systemic and social difficulties that a young person presented within one storyline? So we managed to get some wonderful young people involved in the project, and they really guided our discussions around what to include, what language to use, how to think about the scripts. And my role in it was to come in and really ensure that the storyline was clinically accurate, but also the language in which was used in the script was representative of the conversations that we were having with young people in A&E. Very similarly to what Dorcas said earlier on, it's not about how qualified you are and how much experience you have with young people. It's really about how willing and curious you are to hear their story. And I feel that's one of the things that's been most beneficial to me in A&E when we're seeing people at the heightened level of stress. One of the most containing interventions that we've been able to use is truly just to sit there and give them the space to name and explore some of the emotions and what might be going on for them. Because more often than not, it's often an amalgamation of different things. So we were able to reflect that in the script. We were able to think about what emotions would have come up for each young person and what struggles they're experienced outside of the home. So one of the other major social factors that we saw during the pandemic was isolation. Young people were isolated from their friends. They weren't able to keep in touch with them. And also adding into that, a lot of the financial stress that the families experienced meant that some young people, a large proportion of young people in London actually didn't have access to technology. They didn't have access to laptops to attend school. They didn't have access to mobile phones or tablets to keep in touch with their friends. So we were quite keen to include that in the narrative of the story. And so bit by bit, the story came together. This was a huge project, by the way. I don't think I could do it justice in 10 minutes, but it was a lot of hard work from a lot of different professionals who each brought their own expertise into the picture, particularly the young people that we worked in, who brought in some of their own experiences and kept us grounded in the way we went about it. The film is a short film. It's 20 minutes. It did incredibly well. And a lot of the feedback from people who have watched it sort of been that, yes, I've been suffering in silence, and this film truly captures what I felt and what I experienced during a time that was incredibly lonely. I'd encourage everyone to watch the film. We're going to share the trailer in a minute, but actually watching the whole film to start to finish would help you understand some of the internal suffering that a lot of our young people experienced. And just finally, I think one of my biggest lessons from working with young people during the pandemic was waking up to the absolute resilience, the internal resilience that our young people have within them to cope not only with themselves, with their own difficulties, but also to bring together the collective effort to help their peers to share and to help lift each other up was absolutely something that we saw during the pandemic. And that sort of explained the lag that we saw at the beginning. People were afraid and shocked by the onset of the pandemic, but it actually encouraged them to nurture that inner resilience, which helped a significant number of people. So I'm going to stop now because I can talk about this forever. But I believe Chris might be coming on to share the trailer for the film.
Yeah, let me just.
Thank you. Nushin has introduced Chris partially already, but he's on the screen now, and Chris is joining us. He's a very decorated, award-winning creative director of a production company. So we're really glad that you're with us this evening, Chris, and I'm sure you'll introduce the young people as well. But we're going to cross everything that the video trailer plays, I think.
Okay, I'm just going to play the trailer now. Can you see that?
So we're looking at your home screen.
Okay, so let me just put this on. Okay. It's just okay. Can you see that now?
Okay,
Yeah.
we now have the screen. It's blank at the moment.
Yep. Okay. Okay, I'm going to play it now.
Yeah, playing. Thank you.
You guys worried about this coronavirus? Last year it was bird flu that was going to kill us all. What's it this year? Bat flu.
Prime Minister Boris Johnson has said that everyone should avoid contact with others in an attempt to control coronavirus.
There's a thing that I need to talk to you about.
Okay.
Universal Credit. I'm going to get in touch with them today. I'm going to explain the situation. Visitors.
Tell them I'm not here.
But do your friends, Matt? What's going on?
Come on.
All I know is that it's happening again, and I don't know if I can cope with it on my own this time. Because you're his dad, and I might need a little bit of support. Hey, long time.
Thank you for sharing, Chris. We will be able to share the link for that with everybody. So you will have the opportunity to view it in full. I watched it actually. Palumi presented this in another forum, and we're all nurses and doctors, and we're all so not taken aback, that's the wrong word, but just like, you got this so right. So Palumi and Dylan, would you like to talk us a little bit through your experience of making the film and what it involved?
Yeah, I can. So how we came about it was we did a group of like Zoom sessions with Chris and with some other young people as well, and we kind of just shared our experiences, and we kind of just brought in what we were going through as young people. And one thing that Dylan brought into some of the meetings as well was about, like, you know, that digital divide, and he brought in about like how people have choices, which was something that we wanted to explore throughout the film as well. And we wanted to be as authentic as possible of, like, you know, how young people were, you know, during the pandemic, through our experiences. Dylan?
Yeah, I'd just like to echo what Palumi said. Hi, everyone. My name's Dylan. I'm one of the young people who helped co-create Nexus. I think our involvement with the Nexus project started in around 2021, I believe. And me and Palumi were both involved in a separate project called A New Tomorrow, which was, we were producers for a series of online symposium events all about young people's mental health. We held some online events where we, prior to that, we sort of discussed our own, you know, feelings and experiences over lockdown and how that, you know, impacted on our mental health. And from the back of that, we held some online events to try and help and support other young people, which were around, you know, mental health, specifically about maintaining a good sleep routine and stuff like that. They were a huge success, and we were, you know, it was a fantastic project. But from the back of that, we got to be involved in using that research and using our experiences to create Nexus, the film, which I was really, really intrigued about. I studied film and media in college, and it was something that I've always been quite passionate about. So to kind of merge those two passions was absolutely fantastic. There's lots of there's a range of topics in Nexus. It covers, you know, mental health can be a cycle and a lot of different things. It covers loneliness, isolation, eating disorders. But I guess where my interest in being involved in the film was the idea of one of the characters being in poverty. As I say, I work for an anti-poverty organisation called Thrive Teesside, and I was really sort of keen on one of the characters being in poverty, specifically digital poverty. which I was thankful that that kind of became sort of a huge catalyst in the main character's story. It essentially cut him off from his only contact to his friends. And I think that loss of connection reflected what I was seeing in my own community. People were, you know, locked out of social space and connections if you didn't have access to the internet or a smartphone. But it also locked you out of access to, you know, other things like online education, you know, government and support services, lots of essential services. As you all probably know, you know, internet access these days, it's not just a luxury, it is a necessity to get by and to you know, do lots of different things and manage in a current and technological world. But being involved in the film, I got to learn so much about mental health. I got to learn so much about eating disorders, which I didn't know at the time. And I don't want to speak for all of us as young people, but we truly were involved in every step of the process when it came to, you know, our own experiences. We got to really talk and vent, and we were a soundboard for each other, which it was ironic because we were planning and creating this film while we were still in a lot of the lockdowns, and so we were doing a lot of it over Zoom. So a lot of the stuff that we were talking about, we were kind of still dealing with at the time, but it was a great way for us to get that all out. But we were involved in script writing, helping pick the actors. We got to go and watch the film get made down in London. I had a small cameo in the film, which was really fun. But the whole process was you know, I think the term co-production gets kind of thrown around a lot, but it truly was a blend and of lots of different areas of expertise and lived experiences of, you know, the range of topics that are included in the film.
Yeah, it was. And like I think also what we wanted to do, we wanted to make sure like it kind of carried on and like so we're trying to work on that, like building resources for professionals, for other like stakeholders as well, that, you know, when there are like film screenings of like, oh, you know, these are the things that are going on. And also the topics and the themes explored throughout the film, we still see that right now in this like in this day and age, and at this time. So we're really interested in like what happens next and making sure that like the story continues. So yeah, that's what I just wanted.
Thank you both, Palumi and Dylan. I think that's possibly the best answer I've ever had when I've asked a question of, you got it so right, how did you do it? That was the best answer I've ever had. So thank you both. But I'd like to invite all of our speakers back now. So we'll hold the panel. Now, what I've got next is some sort of what I call questions by consensus. So I'm gonna start off by asking some general questions. And my RCN colleagues are going to be monitoring the chat for anything else that might come up. But can I just thank you all for your presentations, for your absolute honesty. I can tell this has come from everybody's heart. And I think there's something very special that none of you nurses have mentioned, and that is there's something very freeing for young people when they hear the word nurse. There's something about who we are, how we work, what we do, that allows some of that very difficult communication. So I'd just like everybody to think about that, really. It's quite fitting at these times as well. And the other thing I'd just like to say as well is I work in safeguarding primarily now, and we hear so much negativity about devices, about the digital world, about what goes on online. But actually, young people aren't scared about it all. And I think where Dorcas and Nushin have said about having conversations in the right places and spaces for children and young people, we need to get with it, really, don't we? Because that might not always be in a clinical setting or even a community setting. So I'm going to brush up my digital media skills. It'll take a while, but in the meantime, can I put some general questions to all of you? Is that okay? So one of the questions was about involving young people in the work that you do, and I think you've all told us that really clearly, and Dylan and Palumi have perhaps given us the best answers I've ever heard. But how do we get young people involved who really don't want to talk, don't want to come to clinical settings? What's your, if I can ask you sort of one each, what's your magic for making that happen? Nooshin's looking thoughtful, so Dorcas, can I pick on you first, please?
Thank you, Lynn, and such a poignant question. I love that you highlight nursing here. And I might say, before I answer the question, a lot of what I did was probably not going to be possible in a different domain. Medicine doesn't achieve the same. Social workers don't. It's a different relationship, but I also want to extend that and say there's something that we nurses from global majority bring. We bring that cultural context, we bring that much more depth of understanding. So nothing is poignant, and we know that society trusts nursing. Any engagement any conversation requires engagement, and I think Dylan and Palumi allude to it really well. We sometimes think engagement is about 10 appointments and then we finally get to the point. Actually, it's 10 seconds. It's about whether I can trust you with that, whether I can be with you. But do you hear me? Do you know where I come from? Do you know that I live on the 11th floor of Council Estate, and I live next to a drug dealer, and the other side is another drug dealer, and that my outcomes and my prognosis is probably really poor? Do you know that I'm trapped? So I think people want to know that we understand who they are before we penetrate into their beings, before we ask them all these questions. Oh, are you sleeping? Oh, you've got to have a relationship, but that relationship is coined within a very short space of time. And it may be in the text that you send them and say, can I meet you tomorrow? It's the language that you use. Lynn, it's the spoken and the unspoken. It's whether you say, hey, how are you? Or, are we too formal? And I think working around that, and nurses do this quite well because we're around patients 24 hours a day. We are continuously engaging with patients. But for young people, let's pay that much more attention to the language they want to hear and they want to. Before I leave this question, I want to say something about class. When I started this job, I couldn't bear the word in it. And I thought, why would anybody say in it, really? Why are you butchering the English language? By the time I finished this job, I was saying in it. I'm still saying in it because I'm a Londoner. I am a nurse and I'm a Londoner. I'm one of them. And so we must belong to those communities that we come from. Thank you.
In it, Dorcas. Nooshin, do you have anything you'd like to add?
I'd really like to echo that as well, because whilst Dorcas was speaking, what I was trying to think back at sort of my work in A&E and kind of some of the unconscious sometimes strategies that really work for young people. It's so important that when we meet a young person, for us to abolish the hierarchy. These young people already have enough people in their lives telling them what they should and shouldn't do, and the society that's telling them what they should and shouldn't do. So when it comes to meeting them, it's really important for us to abolish that, not to come at them from an authoritarian position, like asking sort of the tick box questions that you're going to ask, but rather actually invest 5-10 minutes into giving them space, getting to know who they are, what is their essence, what are they like, what are their hopes and dreams, if any, in that moment. And also as clinicians, I think it's really important for us to start thinking outside the box in terms of how do we educate ourselves around young people's experiences. For example, at the moment, I'm doing my doctorate in psychology, and the subject that I'm looking at is gender identity development in young people with autism. But rather than interviewing young people, I'm actually using social media platforms and what they've posted it. And the aim of that is that we give voices to the young people who might not come to appointments, who might not show up, who might not have the ability to use language, but their opinions matter just as much. So really widening our perspective as to what we feel is an acceptable interaction, to meeting them at their level and seeing what works for them, and how do we create a platform that amplifies their voices as much as possible, because we're in a privileged position to be able to do that.
Thank you, Nusheen. And I can see lots of nods from my other panel members. Anything to add to what the ladies have said?
I think, I mean, but personally, I don't sort of have sort of direct contact with young people other than through the odd projects that I work on, including Nexus. But I suppose one thing that is quite interesting, it kind of echoes both what Nusheen and Dorcas have said, is it's not getting stuck in the adult narrative about how young people live and how they see the world. Interestingly, you know, in this film, in Nexus, the hero in the film in many ways is the iPad, and that's kind of like sort of slightly counterintuitive when you're thinking we're making a film about eating disorders, and the narrative about social media being one of the causes around eating disorders. We kind of flip that narrative slightly by saying, yeah, okay, social media isn't great for eating disorders, we accept that, but actually what young people needed more than anything was each other. That was their greatest coping mechanism during lockdown, and I think that was a really, really interesting insight. And I like the idea that we flipped that narrative and understood that being together during lockdown in particular, the lifeline was social media. The lifeline was being able to connect with your friends. And interesting, I made a film a few years ago about self-harm, and one of the insights of that film was an understanding that in the short term, self-harm isn't something, is a coping mechanism. It is a coping mechanism. It's a maladapted coping mechanism, but it is a coping mechanism. And it was kind of like challenging that perspective on self-harm, which obviously is something that you don't want in the long term, but in the short term, it is something which is helping that young person get through a difficult time. And so it's about understanding those things, even though we have this very sort of polarized view on these issues, to have a broader perspective and a broader understanding.
Thank you, Chris. And Pallavi, Dylan, anything to add before I pose another question?
I would just quickly like to add as well, I think it's also about ownership, and I think oftentimes it feels like things are getting extracted from you, you know, your personal, you know, your personal life, your stories, your, you know, what you have to offer. If there's not a relationship being formed there, and there's, you know, that's the first hurdle. If that's not being formed and somebody's kind of coming in, taking something and leaving, and, you know, not following up, or I think it's just about making like kind of that shared ownership of whatever the end result is. You know, for us it was making this film. You know, we feel just as important and valued as Chris the director and Lindsay the researcher in that. But even if it's you know, ownership in your own personal wellness, if it's about sobriety, if it's about you know, and you've got somebody there alongside trying to help you, I think it's just about kind of that shared that shared ownership. And I think that lived experiences are just as, you know, important as learned experiences, and that kind of merge, that merge of expertise can be really, really valuable.
That's really poignant, Dillian. Really, really poignant that we do ask young people to share a lot. And that sharing, that ownership, is really poignant. And Chris, what you said as well, about in that moment and the coping strategies. Quite often we have a very adult response that sometimes young people find quite parental and disabling. But actually it's recognising that the young person has a different way of coping, and whether that's something that we find really hard to tackle, like self-harm, or whether it's, you know, a website that you really shouldn't be looking at this age, but actually we need to understand some of what's going on to make that happen. And it's how we share that with you. My young people always say, you need to do this, or you must do that, or stop doing this, or when I was your age. So I try never to say that, but sometimes that gets evoked in me, that parental response, and that's something you really made me think about. So thank you. Palumi, do you want to add anything?
No, I think everything that everyone said is really, really is really, really poignant. But I also say I think that it's really important now to give that like holistic approach as well. That like, because some young people do need that that approach that is, you know, that is like tough love at the same time of, okay, you know, like Lynn, when you said, you know, when I was your age, you know, the things that you say, I think that like what I'm realizing as well is that there needs to be that balance of that holisticness of like, okay, when it comes to like young people in what they need, that they might not know. Like in the trailer when we saw the main characters like mom, and when she was calling his dad and say, okay, I need extra help. I think that like it's really about building that sense of community for young people, that they can feel like even if it's just even if it's just them and their youth worker or their nurse, that there can be community with two people, and within that it can be holistic of like tough love, but also that that approach that is still person-centered, but like just more holistic. And I think that's something also to add. Yeah.
Thank you. Nearly forgot to unmute myself then, apologies. Now I'm going to pose a question that I think is on a lot of people's minds at the moment. It's in the media. There's barely a day that goes past really where we don't hear about young people in crisis, and particularly with a mental health crisis. So just from your perspective, what do you think are the current pressures around children's and young people's mental health, particularly with pressure on services? Like what is it? What can we do? I suppose is the question.
Sorry to just jump in, but like this is such a important topic that I'm really passionate about, because I think when we look at like the different services that are meant to be providing safe havens for young people, they have been underfunded, they've been just disregarded, and like just very much so like taken away. And I think that's very systemic and very like that's been intentional in so many different institutions. When you look at like schools are literally crumbling down. They needed to be built up, and like they were literally crumbling down. Like you look at other health mental health institutions that have been like taken away, and also like the value of youth workers has also been like disregarded. And I think that the ways in which we can like combat that is, it's again that idea of community. I feel like that's the way in which it can help young people, and to show that we're not that people aren't against them, but actually for them. these services. So, and I think that some young people have such distrust within the institutions, and they're so disconnected because the institutions that were meant to be there for them are in a lot of ways failing them, but those institutions are also being failed by the higher powers. So it's like there's a trickle effect, really. And I think that the way you combat that is by showing that togetherness in a way of like, okay, how can I help you? And reaching out cross departments or cross institutions. So, like for example, the police force reaching out to the mental health institutions and saying, okay, what can the police force learn that can, in terms of safeguarding, in terms of like mental health training, or like that kind of approach and community approach would be helpful. Sorry, I know I said a lot.
No, please don't apologise, Palumi. It's really lovely to hear your passion. And I don't think any nurse on the call or anyone at the RCN would disagree with you at all. There's a little career emerging here in politics for you. I think we need you in charge of decision making. Does anyone else have anything they would like to add?
I don't think I can say much more than what Palumi's just said. He's pretty much painted a beautiful picture of some of the challenges that we have and ways in which we can overcome it. I think we need to, as nurses and as members of our wider community, we need to accept that we are going to have to work within very limited resources. And actually, how can we be more creative in how we can use our resources? And it might be something as simple as, like Palumi said, creating spaces for young people where they can come together, support each other. Like the use of crisis cafes are an incredible resource for young people in communities. Where they can drop in, so it's an alternative to going to A&E, but they can drop in there and there's someone guaranteed to be there and literally just have a cup of tea, have a chat, think about the resources that you have available to you and give them some time to breathe, essentially, before they're able to go back out there in the world. So it's investing more into our communities as opposed to looking at investing into our healthcare system, which is out of our hands, but as a community, we can come together and look at how can we create these pockets of support within our individual communities for young people and adults as well, because young people are impacted by the adults in their lives.
Yeah, I'm getting really strongly from all of you this sense of community. So, Dorcas, there's been things in the chat about your friendship bench. So I think that's something we can all do in all of our communities, and to think about that. But how do we build that? So what is it we can do to empower children, young people to be co-creators of those communities?
It's a really, really important discussion, and you know, Lynn, even if I had £1 billion to chuck into the NHS now, I suspect we'll still be here having the same conversation about crisis. So I'm more inclined to say, what do we do with what we have? If I pose the same question to my nurses in India or Kenya, they would say, well, we're going to work with what we have because we're not going to wait for the government. So I think there's something about innovation that needs to be plugged in ourselves, and what does quality look like? What does quality care look like and feel like? Because in the absence of it's very hard to see a GP, let's be honest, me included. It's hard to see a psychiatrist. So I think the use of community is really, really important, but also the conversations. I wanted to say a point that Nushin was sort of alluding to, and I think this is linked to particularly young girls and the conversations that we have around young girls and the spaces that we create around younger girls and language that we create around young girls. The question shouldn't be, what were you doing having sex with that at 16? The question shouldn't be, when I was your age. We have to create systems within the community. And I want to give a very simple example of African context. If I was a young girl at 16 having sex and I was worried about getting pregnant, perhaps I might even be pregnant, that conversation is difficult to take directly to my mom. Impossible. She's going to explode. That's what mom do. There's something in that system, in that culture that bridges me and which is an auntie. And in our culture, it's called a tete. A tete is a lady who's got your back. She's your dad's sister, and she's got your back. She's going to stand up for you and say, look, I've got something that I want to have a conversation in the family about. Dorcas has come up. So we need those protective measures which are culturally defined and culturally appropriate, so that any one of us young people can go and say indirectly to their parents or their psychiatrist or GP, I'm carrying a knife because I haven't been to school, because I'm living next door to I'm in county lines because, and I really need your help. And this is how you can help me. So I guess what I'm saying is that we haven't maximized our communities enough. We haven't maximized the resources that we have enough before we cry for the next bucket of money and the politics around us. And we know that the politics is getting dirtier and dirtier and dirtier and dirtier. And the focus on young people is shifting. This, as wars around us are circulating. So I want to push for greater innovation, and these answers are amongst us as we speak. Thank you.
So, Dorcas, I think you've answered actually that the innovation and change we need is within us all, and it's about how we enable that to happen, and make the conditions safe enough for that to happen. Some of my colleagues do have young people that will come and tell them those things, but some colleagues don't. So it's about how do we make our adults in our communities those people that children, young people go to when they don't feel safe for any reason. And if you do find £1 billion in a bucket, do let us know, because I'm sure we could help you spend it. Certainly, boys, you could make another film, that wouldn't be an issue. Okay, we are at 7:35 now, so I really want to thank the panel for their openness, their transparency and honesty with those questions, because I did pose some difficult ones.